Wearing gloves while unclogging drains is a practical hygiene precaution that protects your skin and reduces germ exposure. When you handle a clog directly, use durable, water-resistant gloves made of nitrile or heavy-duty latex to avoid punctures and chemical exposure. For plunging or using a hand auger, keep your sleeves rolled up and wear gloves that provide a good grip so you can control tools without slipping. If you use chemical drain cleaners, do not rely on thin disposable gloves because strong chemicals can permeate them. Instead, wear chemical-resistant gloves and rinse your hands immediately after removing gloves. For minor clogs caused by hair or organic debris, you can often remove material with a gloved hand or a simple plastic hook and then sanitize the area with a diluted bleach solution or an appropriate disinfectant. When the water looks clean and you are confident no harmful substances are present, you may choose not to wear gloves, but maintain careful technique by avoiding direct contact and washing hands thoroughly with soap and warm water for at least 20 seconds. Keep a pair of gloves dedicated to plumbing tasks in your cleaning kit and replace them if they show tears, stiffening, or chemical damage. People often skip gloves because they think the risk is low, but skin contact with sewer water and biofilm can transmit bacteria, so wear gloves for any direct contact. Another common mistake is using the wrong glove type and suffering chemical burns or punctures. Select gloves rated for puncture resistance and chemical exposure when using caustic products. A third issue is improper removal of gloves, which spreads contaminants to skin and surfaces. Remove gloves by peeling them off inside out and wash hands immediately after. Our site bighomeprojects.com connects homeowners with local contractors for projects like plumbing and home maintenance. We also host a discussion community where we answer questions, share step-by-step tips, and help both homeowners and contractors find work and collaborate.